Hey, it's Monday, and welcome to episode 714 of your Daily Detroit for March 8th, 2021. I'm Jer Stays. Today, Dr. Paul Thomas from Plum Health Direct Primary Care joins me to talk about the state of the pandemic, Detroit's vaccination situation, new CDC guidelines, and their new bilingual doctor. Then, a city councilman is not running for re-election in the shadow of a federal indictment, and the mortgage giants on either end of Woodward are now in open conflict. We'll get started after I thank our members on Patreon who make this show possible. Community funding matters. For as little as $1 a month, you can be part of keeping Daily Detroit on the air, get swag, and get behind-the-scenes updates, and sometimes even access to special stuff first. Members keep the show free so anyone here can listen. So join us at patreon.com/dailydetroit. That's patreon.com/dailydetroit. Joining me virtually, Dr. Paul Thomas. Welcome back to Daily Detroit.
Jer, it's great to be here. Thanks for having me.
And it's good to talk with you again. Things have been kind of quiet on the coronavirus front lately, but we've got a slew of news to talk about and break down, and let's just get right into it. First off, I will tell listeners that this is for educational purposes, and for anything involving your personal situation, be sure to talk to your doctor, right?
Amen. Yeah, you should always have a trusted physician, hopefully a family doctor or primary care physician that you can talk with.
Go figure. I think I know one at Plum Health Direct Primary Care.
Thank you for that.
Well, let's get into it. Made national news, this whole flap around vaccines, Johnson & Johnson, Mayor Mike Duggan, and a series of press events that have happened over the last few days. I'm going to play a clip from March 2nd that really got the ball rolling when it comes to this discussion around Moderna, Pfizer, and the Johnson & Johnson vaccine.
A couple of quick COVID questions, then topic. Christina Hall from the Free Press had been asking if we expect to receive any Johnson & Johnson vaccines.
No. So I do not expect Johnson & Johnson vaccines. Certainly we're not receiving any now. The Moderna and Pfizer vaccines are 95% effective if you get 2 shots. Johnson & Johnson is 1 shot, which is nicer, but it's about 67% effective. Johnson & Johnson makes great sense for people in rural areas where it's going to be hard to get out to them. It makes great sense for people who are waiting 3 or 4 hours in line and aren't going to do it twice, that maybe get 1 shot, because certainly the Johnson & Johnson shot is a step forward. In the city of Detroit, you've got the finest vaccination infrastructure in the country. We can get you in and out quickly through the TCF Center. We can do it twice, and we are going to protect Detroiters with a 95% vaccine.
He doubled down on those comments in another press event a couple of days later. And then just recently, just this morning, and we're recording this on Monday, March 8th, there is an op-ed in the Free Press that Mayor Mike Duggan penned to Detroiters after this Johnson & Johnson vaccine change, because he has now relented and is now setting up a dedicated lane for Johnson & Johnson, a dedicated site. Dr. Paul, what are your thoughts?
I want to echo what he said in his op-ed, is the thing he wrote in the Free Press today. And he was basically saying that any vaccine that you get is going to be safe and effective. So that's the number one thing. These vaccines are safe and effective, and whichever you choose is going to protect you. The Johnson & Johnson confers about 66% protection. However, it has like 85% protection against hospitalization and 100% effectiveness against death. So if it was the only vaccine available, we'd all be leaping to get that vaccine. But we have 2 other very good vaccines, the Pfizer and the Moderna, and they confer 99% or 95% effectiveness against coronavirus. So I agree with Mayor Duggan to an extent. If you have the means and the machinery like we do at the TCF Center to get the people through, and people are typically waiting 30 minutes to an hour and a half to get the vaccine, why not get both and have the highest level of protection? However, this is America. We all like individuality and the freedom of choice. If you want to get the Johnson & Johnson, it should be available to you if that's the one that you'd like to go with. But in terms of safety profile, they're all very safe. They're all very effective. And I think having the option is good.
The talk around this just made national news, and the Biden administration even stepped in and talked about this particular thing in Detroit. And to me, talking to neighbors, there is a hesitancy out there. And I understand, like, we can get into the scientific bits and all of that and the percentages, and both will protect you from the worst outcomes, and both provide a ton of protection in a lot of ways, and both are good vaccines. But when I talk to neighbors, there is this worry, and there is a historic worry in communities of color that, well, why do we get the bad one, right? And there is a perception issue with J&J. And I know that the data doesn't necessarily line up, but like, I know from talking to people that there is that perception issue. I know from listeners there is that perception issue. What could J&J do to help that? And what needs to happen going forward?
Well, I think that Johnson & Johnson just can continue to express the science, continue to tell about the science and the data that supports the vaccine. And I think as more and more people get Johnson & Johnson doses and they tell their stories in the community anecdotally about how effective and how safe and how easy it was to get the vaccine. And it's nice that it's only one dose. So if you don't want to have 2 doses of a vaccine, you can only have the 1 dose with the Johnson & Johnson. I think more and more people are going to warm up to it. Like Mayor Duggan had said, it's a great vaccine for people who are in specific communities like rural areas. It's also great for different communities that may not have access to a car, or 33% of Detroiters lack access to reliable transportation. So maybe you're one of those folks, and it's really difficult to get down to the TCF Center. Maybe the Johnson & Johnson vaccine is for you. You only have to make one trip. So I think the way forward is, educating people, sharing the data, sharing the information, and giving people options so that they can make the decision for themselves. And ultimately, any vaccine that you pick is going to be safe and effective, and it's going to protect you, your family, and our community.
I mean, personally, I'm getting the first juice available, but that's just because, well, I'm me.
Yeah, and I think that's the best way to go. If Johnson & Johnson is available, take it. If Pfizer's available, take it. If Moderna is available, take it. I mean, they're all good vaccine options.
Speaking of options, a question a number of listeners have shared with me: are there concerns about being pregnant and taking the vaccine? We have a number of people who are expecting. They have a lot of worry around that. They maybe haven't talked to their doctors individually yet. And of course, this is for educational, not specific purposes. What are your thoughts around taking the vaccine and pregnancy? And all 3 vaccines for that matter: Moderna, Pfizer, and J&J.
Yeah, so the American College of Obstetricians and Gynecologists, those doctors who take care of pregnant women, lactating women, they just updated their statement March 4th, 2021, and they fully support all 3 vaccines. They say the ACOG recommends that COVID-19 vaccine should not be withheld from pregnant individuals, and vaccines should be offered to lactating individuals similar to non-lactating individuals. So if you're breastfeeding or not, you should get the vaccine. If you're pregnant or not, you should get the vaccine. Now, anecdotally, some OBGYNs have been waiting until the mom is in the 2nd trimester to give the COVID vaccine. So if you are a little bit wary of taking the vaccine, perhaps wait until your 2nd trimester until things settle down with the pregnancy. That's fine. But the bottom line is that it's safe and effective for pregnant and lactating women. And it's been highly recommended by the American College of Obstetricians and Gynecologists.
This next question is kind of a 2-parter. One, I know of a lot of listeners who are peeling off the walls right now with the vaccine rates, fortunately going up in the state of Michigan, more of them getting rolled out. The weather's getting warmer. You've got restrictions that have been, kind of lifted up to 50% for indoor dining. That is also mixed with new guidance from the Centers for Disease Control around fully vaccinated people. And so let's talk about that intersection. First off, do you have any tips for the people who are now thinking that maybe I do want to go out, maybe I do want to engage in the world a little bit more, and kind of reminders for folks? And then secondly, I'd like to walk through the guidelines for fully vaccinated people that literally just came out minutes ago.
Oh yeah, this is really going to bake your noodle or make your head spin. As a human, I'm really excited for spring. It's 62 degrees today. I can't wait to get to the patio, have a patio drink with some friends at some point. And, being vaccinated myself, I've had both of the Pfizer vaccine doses. I feel really confident in the vaccine efficacy, and I'm really excited to see more and more people getting the vaccine. And so that recommendation that you're talking about from the CDC, they're saying now that fully vaccinated Americans can gather with other vaccinated people indoors without wearing a mask or social distancing. So this is just like, if you are lucky enough to have been vaccinated, or if you're in the criteria to get vaccinated, you can now hang out with people indoors without a mask, but everyone in that space would have to be fully vaccinated. Now, if you're unvaccinated, they're recommending that you carry on wearing a mask. And then if you are vaccinated, but you're visiting a household where even one person is unvaccinated, everyone should still wear a mask and socially distance. So this guideline is going to make public health officials dizzy.
I'm dizzy.
It's just tough to roll this out. I mean, I think, the more prudent thing is I'm going to continue wearing a mask until everyone's vaccinated, or until, probably until July 1st at least, just because it sends a message that the virus is still out there. It's still circulating. There are still people being affected. There are 1,500 new cases in Michigan as of yesterday. So we just got to stay the course, keep protecting our neighbors, get vaccinated when you can, wear the mask. I know that there's this new guidance from the CDC, and maybe that gives you some encouragement to venture out into the world. But if you see me out, I'll be wearing a mask unless I'm actively eating or drinking on the patio outdoors,
Well, let's get to that point. The patio outdoors, I think we need to reiterate that although there's this 50% level and some people are going to be comfortable eating indoors, like the science of the virus doesn't change, right?
Yeah, that's correct. And if you are unvaccinated and you do decide to go indoors, you're putting yourself at risk for catching the virus.
Right.
Because, frankly, once people get into a restaurant, they take off their mask and they have a couple drinks and things start to get a little bit lax in terms of the rules. And that's just human nature. So, the best thing to do is, if you are unvaccinated, hang out in the patios, wear your mask unless you're actively eating or drinking, and, wash your hands thoroughly before and after your meal. This is just something that we're going to have to deal with probably for another 3 months. I think most people are thinking, July 1st, we're going to start to really see the effect of all of these things get into place, like the vaccines and the social distancing that we've been abiding by. And we're going to start to see the fruits of these labors.
Dr. Anthony Fauci and others in a briefing on Friday talked about their concerns around another spike, right? We have hit a plateau in Michigan, but that plateau is higher than it was over the summertime. Like, we are not in the doldrums as we were. We are definitely at a higher community spread level. There are some indications of spread in different counties. He has a worry nationally that we're going to see another spike before this thing is over. How do you feel about that prognosis?
Yeah, it's hard for me to go against Dr. Fauci. And it's definitely possible because there are, just looking at Detroit, like Mayor Duggan had said in this op-ed, only 11% of Detroit residents have been vaccinated so far. Even though, they've given 100,000 doses out of the TCF Center, only 11% of Detroit residents have gotten the vaccine. So that means that 89% of your population is unvaccinated. And that pattern probably holds true across the country. I think we're getting close to maybe 12 or 13% of people have gotten the vaccine nationally. And so you're really vulnerable to another event until you get to 50, 60% immunity. You're still very vulnerable to a spike in the virus. So I think it's really prudent to exercise caution and do your best to keep fighting the virus by wearing the mask and abiding by these socially distanced rules.
There is a light at the end of the tunnel, but we still are kind of at a wobbly time, it seems.
Yeah, we are.
Well, before I let you go, I wanted to share some news from Plum Health Direct Primary Care. I'm excited about this one because as a city resident, I think it's important that all residents have the ability to get care and get it in a comfortable manner. You've actually hired a bilingual doctor, which I'm excited about. Can you tell me about her?
Yeah, so Dr. Leslie Rabaut has joined our practice. She's a family medicine doctor, and she speaks Spanish and English. And we're really excited to be able to serve more people in our community with, patient-centered care that's humanistic and that's in multiple languages. And we're just ecstatic to have Dr. Rabaut on our team. She actually grew up here, born in Detroit, and went to St. Clair Mounty Falco for elementary school. She was telling me about that. Went to Grosse Pointe South High School and went off to Michigan State University for undergrad. She's been around here for a while. She went out of state for med school in Chicago and her residency in Wisconsin. And it's great to have her back in the community and serving people in Detroit. And I'm just extremely excited.
Our suburban listeners might not know that there is just a huge Spanish-speaking community just down the road of Michigan Avenue from you. Now, you're in Corktown, but just go down Michigan Avenue, go down Verner. It is a diverse, beautiful community that really, needs more access to things because, they're working all kinds of jobs, and healthcare is not necessarily the best for a lot of those kinds of jobs that folks are working right now.
Yeah, unfortunately, there aren't that many primary care doctors in the city of Detroit. There's probably only 100 primary care doctors for 680,000 residents. So that's one doctor for every 6,000 residents. And very few primary care doctors in the city of Detroit speak Spanish. And so we're really excited to be able to offer that to the community, somebody who's culturally competent and speaks Spanish and can help to serve people. And there are few healthcare options in Southwest Detroit, and we're really happy to offer family medicine, evidence-based care at our clinic.
Yeah, and you're right off of the bus line, right near Michigan and Trumbull, and people can find it very easily.
Yep. We're walking distance to Rosa Parks Transit Center. We're right on Michigan and Trumbull, Michigan Avenue, facing out kind of near Bucharest Grill. So kitty corner to us for all those Bucharest aficionados out there. And it's nice being on a bus lane. There's also bike lanes in front of our office. So we are as accommodating as we can be to people on other, forms of transportation who are trying to access our care in our clinic.
I don't even want to speculate how many shawarmas per month are consumed by your office.
We do get some shawarmas from time to time, but there's so many good food options. Got to give a shout out to folks like EMA, Michigan and Trumbull Pizza, Folk Detroit, on and on, Mercury Burger Bar, Slow's Barbecue, they're all in our neighborhood. So it's really tough to pick just one favorite.
That is very true. Well, Dr. Paul Thomas, Plum Health Direct Primary Care, thank you so much.
Hey, thanks for having me on, and stay safe and healthy, everybody out there. And whichever vaccine you're offered, take it, because it's a ticket to protecting yourself and others.
Here are a couple of things to know today. Embattled Detroit City Councilman Gabe Leland is not running for re-election. Leland represents District 7. Think a strip of the city's west side from Rouge Park to about Dexter-ish. Leland has been under more scrutiny after being charged with misconduct in office last year for accepting money to influence how he voted. The charge, if found guilty, carries a maximum penalty of 5 years in prison and a $10,000 fine. It stems from allegations Leland demanded $15,000 in cash and auto work from businessman Bob Carmack to help him in property dealings with the city. The trial has been postponed numerous times due to COVID-19. Now, Bob Carmack, if you remember, was also the guy who hired a private investigator to track Mayor Mike Duggan down at a home in Novi. First saying Duggan didn't live in the city, and then it's where Carmack contended Duggan was allegedly having an affair. Duggan publicly said he'll never comment on his personal life, but 6 months after this incident became public, he and his longtime wife, Mary Loretto Marr, divorced. And finally, United Wholesale Mortgage and Rocket Mortgages, formerly Quicken, are clashing publicly. As a refresher, generally in the past, Detroit-based Rocket served consumer lenders, and Pontiac-based UWM served independent brokers. But Rocket Pro TPO, a part of the family of companies, has been moving into UWM's vertical. So late last week, the president and CEO of UWM, Matt Ishbia, issued an ultimatum to brokers and owners that UWM will no longer work with those who work with Rocket Mortgage, and gave them just about a week to sign an addendum and pick sides. Ishbia also called out any brokers that work with Fairway Independent Mortgage. UWM contends that Rocket Mortgage and Fairway are, quote, hurting the wholesale channel, unquote, and do, quote, underhanded, quote, deals, soliciting loan officers away from brokers as well as working directly with real estate agents to cut brokers out of the entire process. In the publication The Mortgage Note, there were two strong reactions from industry organizations. Kimber White from the National Association of Mortgage Brokers said, quote, we're not sure this is even legal. It certainly isn't ethical, unquote. Also in the Mortgage Note, The former CEO of the Mortgage Bankers Association and former Federal Housing Administration Commissioner David Stevens said it was, quote, one of the most bizarre things I've seen in my career, unquote. Rocket has more than tripled the number of brokers they've worked with in the last 3 years. It's common that brokers work with a number of lenders depending on the individual deal. I'm not sure what's going to happen or how this will play out, but this battle between two giants on either end of Woodward Avenue is reminiscent of the days when crosstown automotive rivalries dominated the pages of newspapers of yesteryear. And we are done for today. Thanks so much for listening to Your Daily Detroit. Don't forget to follow us in Apple Podcasts, Spotify, Google Podcasts, or wherever you download your favorite shows. Don't miss another episode. We do this every weekday. I'm Jer Stays. Take care of each other, and I'll see you around Detroit.